Hi everyone, today we are doing a lifting thread treatment. We are using VSoft lift threads. My thread choice today was a 17 by 70 Arte 3 thread for her nasolabial fold, and then we did 18 gauge Arte 1, 18 by 100 millimeters for her other vectors here. So for her marionette line, which I just drew, we actually did 2 down to that marionette, and then 1 down into her jowl. And we're also doing 2 of those 18 by 100s to her jawline as well. So just pinching that tissue there, making sure when I'm placing my thread that I'm going all the way down as far as I can into that little pocket of tissue. I also marked off my antegonial notch there. That is where our facial artery is coming up and into the face. With PDO threads, we don't have that risk factor of an occlusion. However, my goal is to not bruise the patient or just minimize my bruising and swelling as much as possible. If you were to nick that facial artery, the patient would swell up in a pretty large hematoma. So our goal is to avoid that, as much as possible. With lifting threads, swelling and bruising is to be expected, but we are above any major vessels here. So unless, your placement is not correct and you're too deep, there's very limited risk when placing PDO lifting threads. So starting off, I opened up my pilot hole with an 18 gauge needle, and now I'm going in with my cannula. For this portion, I just like to open up my space. So I'm going down and creating my vector in each area. And inside my syringe, I have 2% Lido, and I put a little less than 0.05 per vector. You don't want too much fluid in these vectors, otherwise those barbs on the threads are just going to be floating. And we want it to be able to engage in the tissue. That is what's going to give us the best result. So of course we want our patient to be comfortable, so I'm placing lidocaine for comfort reasons, but I'm just being careful with how much I'm placing. So each vector, I just am continuing all the way down. You can kind of tell by my lines here, and you'll see when I'm placing the threads as well. As I was marking up, we're either stopping before the deficit or after. So for the nasolabial fold, I chose to stop before. And the reason for this, and for either starting before or after or stopping, we don't want the end of the thread to be in an area of animation. So for example, if I were to stop right in her nasolabial fold with that 17 gauge thread, there's a high probability that when she's smiling, you would be able to see it because it's pulling back that tissue. So always go either all the way past or stop before, just to limit that risk of having that thread visibility. It would also be quite uncomfortable for the patient as well if it was moving in that area of animation. So just continuing along my vectors and placing my lidocaine in each vector. I go as far as possible with my cannula, and I just kind of pinch that tissue over, and here I'm just going all the way down into that jowl and then placing some lidocaine. So here's my first thread. This is a 17 gauge thread, an Arte 3, and it's 70 millimeters, not 100, so just a little bit shorter. You could use a 100 as well. I was just going into a shorter vector, so I chose a 70, but it's always possible to cut off that excess. But once you get the hang of placing these threads, they are quite easy to place. And you can kind of see with my left hand, I am feeling as I'm going. And this is just for my own comfort to ensure that I am maintaining that same plane the entire way down the vector. This is going to prevent any dimpling in the tissue. I want to be in that SMAS layer. So I'm deep enough where we're not going to be able to have any thread visibility, and we're going to get the best lift. But just making sure that that's a continuous, smooth vector. If it's waving through that tissue, you will be able to see dimpling. So I always just check as I'm going along. And you can see there, I was just trying to move some of her baby hairs out of my area. I take an alcohol wipe here in a second, but I always put a headband on my patients. I'm trying to keep the area as clean as possible. I am not sterile here with my gloves because I am not touching my threads. I'm not tying my threads. If I were to be tying or doing any manipulation with my threads after placement, I would be using sterile technique. But we are just using clean technique here. The patient was cleaned with HIPAA cleanse prior to treatment. Of course, all makeup removed, and then alcohol as well right prior to starting the treatment. But all of these ends here, I am going to be snipping off. And now I'm going in with my last thread down to that jowl. Again, just kind of feeling as I'm going along. And you can almost see the outline as I'm lifting up, like where my thread is placed. So once I'm all the way down into that jowl, I do a nice pull up and just follow that thread all the way up so those barbs engage. Once I have all my threads placed, I like to do a very gentle tug. I'm not pulling that thread out. I just want to make sure that those barbs are engaged. And then I just go ahead and snip off all my threads. I do 1 or 2 at a time just because I do use disposable scissors. So those scissors I will be getting rid of. So they just come in a pre-sterilized kit with tweezers as well. So they're not the best scissors because they are disposable. So I just do 1 to 2 at a time just to make sure that I'm clipping them as to the skin as close as possible and just popping those right into place. A little hack, but also here's me just pointing out how curved my jawline factor now looks. That just is how much lift she actually ended up getting, which is pretty amazing. But a little hack with your pilot hole, if you ever find that those threads aren't popping in, you can take your introducer needle, your 18 gauge, and go the opposite direction, make a little opening, and then push over, and the ends of those threads should pop in. We're just making a little extra room for them. So that's just like a little hack if you ever find yourself in that situation, but just make sure you're, cutting them as close as possible to the skin. We're going in with that same process here, going in with my 2% lidocaine, following along my vectors. And my vector looks a little bit different here because of course my line is now curved and I don't want to be placing them curved, so I did go in a straight line. But here I'm just changing my depth a little bit. We want to be careful around the mouth. Again, very nervy here, and we want to make sure we're past that deficit. Again, we don't want any visibility of those threads. So just placing my lidocaine for her comfort. But as you can tell, she is relatively comfortable. I tell patients that this mostly, it's kind of just a different feeling. It's not necessarily extremely painful, but we're popping through some of those ligaments. So it's almost like kind of like a creepy feeling more than anything else. And then the lidocaine just takes that edge off. So going in with my last 2 threads here. Again, these are 18 gauge by 100 millimeters, so I have plenty of length to get all the way past that area of animation. Again, just making sure I like my placement all the way across. And then we're gonna go in with our last thread. This patient has had threads before, so she is a pro at this, so that's also why she looks relatively comfortable. She's been through this treatment before, gone through the healing process, so she is a pro at this point. So this is my last thread here, and I'm gonna place a Band-Aid. I have my patients leave these Band-Aids on for the rest of the day. I do allow them to take them off night of, a gentle cleanse. No makeup for the next 48 hours. I tell them no skincare products for the next 48 hours, just to keep those areas extremely clean. But I don't, recommend they put Band-Aids back on unless they want to. Those sites do start closing up within 24 hours, but I really want them to be keeping them as clean as possible.